Hi, my name is Emily and I'm an occupational therapy student at the University of Utah. Today I will be providing you with a brief overview of spinal cord injuries. So first, what is a spinal cord injury? The spinal cord and brain make up the central nervous system, and the spinal cord is responsible for coordinating the body's movement and sensation. When the spinal cord is injured, it loses the ability to send and receive messages from the brain to the body's systems below the level of the injury. An injury to the spinal cord or spinal nerve roots results in temporary or permanent change in an individual's motor function or movement, sensory function, affecting their ability to feel something that comes in contact with the affected parts of their body, and or autonomic function such as bowel and bladder function. A spinal cord injury can result due to a traumatic event such as a car accident, a fall, acts of violence like a gunshot wound or a stabbing, or participation in various sports. Non-traumatic injuries typically are caused by degenerative nervous system diseases such as multiple sclerosis, infections, lack of blood flow to the spinal cord, and more. The image on the left is a nice visual of the spinal cord and how nerves at each level innervate different muscles in the body to produce movement. As you can see, the cervical nerve levels at the top innervate muscles that move the neck, shoulder, arms, and hands, where the thoracic nerves innervate the chest and ab muscles, the lumbar levels innervate the legs, and the sacral nerve levels innervate bowel, bladder, and sexual function. The photo on the right provides a simple image of how different spinal cord injury levels typically result in different levels of paralysis. For example, a person who had a C4 injury, which is the fourth vertebrae of the spine, typically results in paralysis from the level of the neck and below, as shown in the top picture. Whereas an individual with a lower injury, such as a lumbar injury, still has function of their upper body, but has paralysis from the waist down, like in the bottom picture. Tetraplegia and paraplegia are defined in the following slide. A few more things to know. The image on the left from the previous slide provides a visual of tetraplegia and paraplegia. These terms are important to know because students at Wasatch Adaptive Sports might refer to themselves as a para or a quad, so it is important to be familiar with what they mean. Tetraplegia is the newer term for quadriplegia, though many still use the term quadriplegia. This means that the individual likely suffered a cervical or neck spinal cord injury, resulting in some degree of paralysis of all four limbs and their trunk. Paraplegia is typically caused by an injury below the neck and results in some degree of paralysis of their lower extremities, though their upper extremities usually function typically. It is also important to know what a complete versus an incomplete spinal cord injury is. An incomplete injury means that the person has some motor and sensation function below the level of their injury, where a complete injury means that they do not have any. A common misconception is that a spinal cord injury means that the spinal cord is completely severed in order for a loss of function to occur. This is not always the case, as they might have an incomplete injury where only part of their spinal cord is severed, or their spinal cord may be intact, but the spinal nerves have been injured and no longer function. As you can imagine, a spinal cord injury can potentially affect every aspect of a person's life. If an individual no longer has function of their hands or any muscles below due to a cervical level injury, they will have to learn alternative ways to complete their desired tasks, such as eating using a piece of adaptive equipment that does not require them to grip their eating utensils. Additionally, because many individuals with a spinal cord injury are typically wheelchair users and do not have function of their legs, activities that they used to participate in, such as bicycling, may now look very different for them, like this lady who is using her arms to ride a bike. You might see this when volunteering at Wasatch Adaptive Sports. Now we will discuss common complications and things to be aware of. First, as mentioned in previous slides, a spinal cord injury typically results in a loss of bowel and bladder control. While the individual will likely have this under control using their bowel and bladder care routine by the time you work with them at Wasatch, this is important to be aware of so you know that you do not need to ask them if they need to go to the bathroom, etc. However, because these students will likely have a catheter, it is important to be aware that a blocked catheter may be the reason that an individual with a spinal cord injury experiences autonomic dysreflexia, the next bullet point. I'm going to skip autonomic dysreflexia, pressure sores, and spasticity for now, as those will be briefly discussed in the following slides. However, because individuals who have had a cervical or thoracic level spinal cord injury lose function of their trunk and ab muscles, their breathing is often affected. This is important to keep in mind when working with these clients, as they might fatigue easier. In regard to pain, individuals with a spinal cord injury can still experience pain. This is important to be aware of in order to allow the client to stop when they feel pain and to not encourage them to push through the pain. Autonomic dysreflexia is a condition that causes a sudden onset of extremely high blood pressure. It is a very complicated process, but to put it simply, blood vessels below the level of the spinal cord injury constrict or get smaller to alert the individual that there is something wrong. The autonomic system attempts to fix this problem by dilating the blood vessels, but the message cannot be received at or below the level of the spinal cord injury, so the blood vessels above the injury continue to dilate or get bigger. This commonly results in a flushed face, sweating, a headache, nausea, etc. As this image depicts, it is commonly caused by restrictive clothing, pressure sores, and full bladders, though it can also be caused by a blocked catheter or overfilled collection bag, cuts, bruises, etc. Typically, once the noxious stimuli is removed, the body quickly returns to its typical state. This slide is not meant to scare you, but to make you aware of the importance of proper positioning, making sure their pants aren't bunched up, their catheter isn't kinked, etc. As mentioned, one cause of autonomic dysreflexia can be pressure sores. Typically, we reposition ourselves throughout the day when we cross our legs, change our posture, etc. Because individuals with a spinal cord injury do not have motor and sensation function, they are more prone to stay in the same position for hours at a time, which increases their risk for sores. Though at this point, the individual you'll be working with at Wasatch Adaptive Sports is likely aware of pressure sores and how frequently they need to reposition themselves, it is nice to know what this may look like. They may tilt their power wheelchair all the way back for a few moments, lift their lower body out of the wheelchair using their arms, lean forward in their wheelchair, etc. Spasticity is an involuntary muscle contraction that occurs below the level of the spinal cord injury. While it may catch you off guard initially, it is important to note that it is very common for people who have experienced a spinal cord injury, and it will typically settle on its own. It's important to know that it's not always a bad thing. Spasticity can help maintain muscle mass and it can increase overall function. This PowerPoint is only a very brief overview of spinal cord injury. If you have any additional questions, once again, my name is Emily and I've provided my email here.